Hello, everyone. Thank you for joining. I'm Carrie Eaton, Marketing Manager at Laerdal Medical, and your moderator today. Welcome to Helping Prepare Your Organization for Coronavirus webinar. It should run about 40 minutes with time for Q&A at the end. If you have any questions, please type them in using the Q&A button at the bottom of your toolbar. The coronavirus has created a healthcare crisis that has put a major training burden on hospitals, emergency medical services, and long-term care facilities, among others. In order to assist you in preparing your staff and teams, we can offer you free training resources at laerdal.com/coronavirus. During our time together today, we will demonstrate how to use a peer-reviewed, pre-programmed scenario. Please welcome Kelly McKeever, Virtual Education and Content Development Specialist from our Educational Services team. Kelly, over to you.
Thanks, Carrie. And again, welcome folks to our Helping Prepare Your Organization for Coronavirus webinar today. Just again, wanted to let you know that you've been allowed onto when you signed into the webinar today, that you're in a listen-only mode. And again, that's just kind of to contain some of the conversations and the noise so that we can get together toward the end of the webinar to discuss questions that you may have. So with that, I just need to, again, provide a shout out for those of you across the globe and wish you a good morning, a good afternoon, or a good evening, wherever you may hail from the globe. And to just let you know that for you, we know you're on the front lines of this horrific pandemic, and we just wanted to say thank you to those healthcare workers around the world who are fighting COVID-19. We see you, we thank you, and bless your efforts for everything that you've done to this point. So in addition to that, we want to essentially emphasize our company mission in that it is in helping save lives. And this is what drives us to live our mission in improving global health are essentially the reasons why we come to work every day. And we understand this from the perspective of our company, that we're not directly involved in the activities of actually helping save lives like you folks are. But we certainly understand the burden in supporting you from the standpoint that many of us do have medical backgrounds and have worked the jobs that you do and do have healthcare experience. In fact, our executive director of our services line still works at least once a month as a unit-based pharmacist for a local hospital. And again, that just kind of proves that that we're out there. We do understand what you're going through. But from the standpoint of the company, we just know it's hugely important that we clearly communicate how our software platforms work, how our mannequins and our other products work to allow you to simply do your jobs more efficiently and effectively. So with that, we again thank you for all of your efforts and such. So also, as Carrie mentioned, this is going to be kind of a synopsis or going over a peer-reviewed article that was written in terms of coronavirus in January. And I would like to make sure that we mention the physicians who were the architects to the peer-reviewed article, and just give them a thank you for keeping out in front of the situation as best we possibly can. And again, to just provide them credit with the work that they've done. So because of that, we also need to let you know that there is a disclaimer attached to our efforts as well, that the tools that we're providing in the webinar are based on the article by EM SimCases and provides information relative to the pandemic. They are designed to assess and improve your team preparedness for the safe and effective care of a critically ill coronavirus patient from triage through intubation. And we want to offer these tools as a training resource only and not meant to be a substitute for any advice or information provided by physicians or other healthcare professionals. So individuals shouldn't use the information contained for diagnosing a health or fitness problem or disease, and should always follow internal policies, procedures, and protocols as you have with your facility and your system. So once again, to restate some of the information Carrie gave you, we will take a quick look at the peer-reviewed article, the peer-reviewed information entitled Suspected Coronavirus COVID-19 with Respiratory Failure. And then for the meat of the discussion, we're going to jump into our current software offerings and show you just exactly how we've programmed the imperatives set by, or the objectives set forth with the authors, into a scenario that you can use directly and right away with your Leap platform. We've also programmed these, or the information, into a LEAP theme file, as well as both for SimPad, a SimPad scenario and a SimPad theme as well. So we want to let you know that these are downloadable, that Carrie had mentioned the website. We will show you what the website looks like and show you essentially where these files are at, so that you can get a hold of them as soon as possible and use them in your environments as you see fit. So the way that we're going to get there, the roadmap today is, again, the brief description that I've mentioned. I want you to basically take a look at the objectives and flow from the perspective of the authors, just because, again, I know that most of us have opinions on what it is that we've seen, some of the things that we've experienced with COVID-19, in addition to any presentation of patients. We all tend to have some opinions, and as information tends to change, we want to make sure that you understand with the case flow, that our scenarios are not locked down. They are basically freeware. You open them up and you are free to essentially modify them at will. So if you have specific policies, procedures, or protocols in one part of the world, or maybe one part of the United States, and you need to create or at least modify these simulations to your specific needs, this is entirely doable. So we have not locked down any of the code. Everything is yours to use as you see fit. So, and again, going to be important that I just show you the case objectives and flow from the perspective of the authors back in January, and understanding how, again, information changes, how presentations change, so on and so forth. We'll also show you the digital accompaniments with the case resources. There are x-rays available and ultrasound. And again, we're going to mention a prop for your mannequin. The authors did put together a way to make the mannequin sneeze, and of course elicit particulates in with the sneeze as well. And we will forward those documents to you just for your use if in fact you want to make your mannequin do whatever it is that you think it needs to do to provide the clues of COVID-19 to your workers, your learners, whatever the population might be. We're going to end with the article itself, with a facilitator cheat sheet and debriefing tips download. Essentially, what the authors did was to be able to put together this peer-reviewed scenario, and then put together a really nice debriefing sequence on the end of it. So nobody's going to be left out in the rain in terms of being able to effectively debrief the circumstance and the simulation. The authors pretty much took care of that for you. So there are some really nice pieces of information regarding debriefing with this simulation as well. And again, like I said, we're going to take you through the LEAP scenario navigation, SimPad theme navigation, and provide some time for you at the end of at the end of today's discussion to ask some questions in case we can provide you with further information on how to mitigate this situation as best we possibly can. So once again, case description: we have a suspected coronavirus patient with respiratory failure. Again, to restate, it was designed in January 2020 in order to assess and improve team preparedness for the safe and effective caring of a critically ill coronavirus patient from triage to intubation. Now, what the authors basically did with this simulation once they created it was to create a hybridized type of a simulation, meaning that it's going to start with a standardized patient that allows better quid pro quo conversations, history gathering between the care providers and the standardized patient. Sometimes simulators are difficult to communicate back and forth between, and everybody kind of has their opinions on how to use the devices according to their specific wishes. But with this, just understand that you don't need to start out with a standardized patient if you so desire. This, again, has been able to be, we provided the files so that you can modify this to any circumstance that you may have. Again, with respect to EMS, potentially military, again, facility-based training with respect to university, potentially in a hospital by itself as well. This is an entirely modifiable circumstance, but we have to base our information on peer-reviewed information and imperatives, just to make sure that we're following the correct roles with respect to the medicine and symptomology. So because of that, the educational goal of the authors, again, practice personal and team safety while providing care to the patient with respiratory illness in full protective, personal protective equipment. So medical and resource management objectives: we're looking for effective communication for triage to intubation of this patient, mitigating exposure of our colleagues, patients by appropriately isolating the high-risk patient in a negative pressure room or whatever isolation rules that are provided by your profession. Mitigating personal risk by utilizing appropriate donning and doffing of personal protective equipment as well, and then conducting a high acuity clinical care in space and personnel limited negative pressure rooms effectively as well. So this is the overriding or overarching goals of the set forth by the authors. So the case flow and progression of this were initially the patient information that we're given with this patient. Is she's a 35-year-old woman who became febrile last night with cold-like symptoms and woke up acutely short of breath. And again, here's the debatable aspects right here as far as productive cough, rhinorrhea, and a subjective fever. So once again, even though this information has been provided by the authors, in your circumstances, you can feel free to change these elements in any way you see fit. The patient screens positive for potential coronavirus exposure due to the fever, respiratory symptoms, and a high-risk travel history. So she has no significant past medical history, takes the requisite acetaminophen, ibuprofen as needed. So extra patient information is that once we have the information provided by the quick history that she does prove as a risk for coronavirus, the history travel is given, and we now replace the standardized patient with a mannequin. And again, this could be the mannequin of your choice. So the patient presentation and progression are as such. At triage, when she steps in through the door, she's a little bit tachycardic. The pressure seems to be reasonable, respiratory rate a little tachypnic. Again, you can see the saturation and the temperature associated. However, she is alert and oriented ×4, person, place, time, and event. So you are able to get accurate information from her. And as you take a cursory look through the presentation of the patient, she essentially just kind of deteriorates as time goes on, and through initial assessment, intubation, and then once she's intubated, disposition or the end of the simulation pretty much arrives at when the patient, once they're intubated and transferred off to an ICU, or in an EMS case, maybe she is essentially transferred into the care of the hospital folks. This could be essentially the end of the simulation, where you may now start talking about exposure management imperatives to ask the team what they should do now that they are potentially exposed to potential coronavirus and such. So that again is kind of the patient presentation progression throughout the simulation. And here are the resources, and we wanted to make sure that you do have these resources at your fingertips. You will receive a recording of this webinar and are able to go back and see the links associated with, again, the digital additions to the simulation, from an X-ray through the ultrasound. There is an ECG available in terms of a 12 lead as well. However, with our software, we're able to demonstrate that straight across in the operations of the software as well. So we did forward again. If you want to make your mannequin sneeze with an aerosolized particulate type of an appearance, there is a wonderful download that we're going to provide you to show you how to do that with your mannequin as well. Then again, we wouldn't be complete unless we offered the following references. And again, this is just the information provided by the authors, where they got the information they needed in order to facilitate the information we do have. So with that, I'm going to move on into our software and show you how these simulations would work from the perspective of our software. Once I'm done with that, we're going to show you a little bit of information on how to download them. But again, this is just for, in terms of your operations, this is the way things would look for you. So I'm going to show you this in a couple of manners. First and foremost, once you start the simulation, those of you familiar with our simulation equipment know that you have an instructor application on a LEAP-based computer, typically with a mannequin and a patient monitor that accompanies it as well. Once you start the case, you're going to be provided with a prebrief that's going to be consistent across the board with all of our presentations that you can read to your learners, or again, modify this as you see fit. If this is not the information you want to provide to your learners, again, highly modifiable. We'll make sure that you understand that source and how that's actually accomplished as well. So what the patient monitor would look like, and in addition to that, now what would this look like from the operator's perspective? So this is our instructor application, and I'm simply going to step in and start the session. So I'm going to make some assumptions that people have been around this screen to a degree, but we all basically have our own ways of running simulations from a software perspective, in addition to some pretty strict opinions on how we like things to look from our screens and so on and so forth. But the way that we designed this simulation was really over here in the event menu perspective. So I want to draw your attention to this, that we do have two columns of buttons provided for you, and what the buttons on the left-hand side are really entitled assessment and treatment options. So these are the behaviors that the authors expected of the learners or the healthcare providers in the circumstance of the COVID virus exposure. So again, gathering travel histories, getting vital signs, applying personal protective equipment to the patient, and on down, calling infection prevention and control officers, or enacting specific procedures inside of your facility based on what your procedures happen to be, applying personal protective equipment to all healthcare providers, so on and so forth. Now, this is in a rough sequence of expected behaviors, but not necessarily in a perfect order. Again, these are the elements that we're going to debrief to once the simulation has ended. These are going to be the things, again, that we look for basically for the learners to provide, just to restate. I want to also draw your attention. I'm going to move to the right-hand side of the screen, and I'm going to show you this prediction area over here to the right. And if this is not one of those things that you do consistently, it's just one of my, in my opinion, this is a very important part of the dashboard to kind of predict the patient's health here. So this white line just straight in the middle gives us what is occurring now with our vital signs. And you can see that these lines are the same colors as the vital signs that are placed in the upper screen above. So as the lines are horizontal, that means that there's no predicted changes within the next 10 minutes, nor have we seen any changes in the past 2 minutes with this patient as well. However, because the patient does have a relatively significantly low pulse oximetry, we may want to add oxygen to this patient. So at some point in time, and this is where I wanted to show you in terms of the operations, you never have to do anything to this interface other than click the buttons to the left. So as we've applied oxygen, you'll notice that there's going to be a slight change in the future of the patient here. So what we've done is basically provide a little bit of vital sign acquiescence to the oxygen. So if they do give oxygen, the patient's going to improve to a slight degree, but not an overabundant. It's not going to cure the patient. And that's where the simulation resource buttons back here to the left actually come into play. So again, assessment and treatment options on the right, and then operative over here, you can see as far as the resources are concerned, we can make this patient deteriorate somewhat, recover somewhat, provide x-rays, provide ultrasounds, and actually make the patient cough if we so desire as well. So I'm not sure that you can hear that on your screens, but on mine, the patient is provided, or it's given a dry cough is what it actually sounds like on my side. So again, first thing is once we get the travel history from the patient, remember that our healthcare providers, our EMTs, whomever it happens to be, is questioning the standardized patient at this point in time, and then finds that there's been high-risk travel history. Once that has been obtained, we click this button, and then up pops an instructor message that provides the leader, again, with a little bit more information, and again, just to let you know that now that care has been placed in front of the mannequin, care is now to the mannequin and not the standardized patients. Once we've read that, once we understand it and applied the information, simply click OK, and we're off and running, okay? So as your healthcare providers obtain vital signs, we give it a click, and we make sure that we're giving credit where credit is due. Once a specific behavior has been observed, I'm just going to have your attention move down to the right-hand side down here at the lower end of the screen, and notice that the travel history was provided at 3 minutes and 25 seconds into the simulation. And again, we got vital signs at 3 minutes and 50 seconds in. So again, all elements of your debriefing once you get to that point of the experience. So again, I'm just going to take it quickly through over here to the left-hand side, the simulation resources and why you never have to touch any other part of the screen. If you would like a chest x-ray, we simply push the button and up pops the information on our patient monitor. Okay, and we can simply close that by having the learner either touch this, the X in the upper right-hand corner, or we can move to our screen and close the pop-ups as well. So moving back to the screen, if we would like a point of care ultrasound provided, same information pops up and gives you the actually moving file of the ultrasound itself as well. Okay, so once again, all we have to do, and these are repetitive. If you want the X-ray again, you simply pop that up and there it is. So you can push this X-ray as many times as you want. And then once it's been actually activated on this screen from the patient monitor, we can always go back and get that radiology if we so desire from the software where it says radiology down here. Click the button, there they are. Learner can access these at any given time, okay? So moving back to our software, just to kind of close this out, I want you to take a look again over here at the prediction screen to see what mild deterioration, what mild recovery looks like. And essentially we put these buttons in at the request of certain instructors, just simply from the perspective that maybe we want the severity of the patient to vary between groups. Again, the objectives remain the same, the outcomes remain the same, it's just how quickly you want to drop a prospective hint that the patient is deteriorating or potentially recovering as well. So I'm going to click on a mild deterioration and then just notice what's going to occur with our patient over here to the right. So obviously our heart rate's going to increase, our blood pressure is going to drop somewhat, and our saturation levels are going to continue to drop. And again, just giving hints to the learners, we need to intervene. So you always have that button, and then it's conversely, it's opposite over here with a mild recovery. So if I click on mild recovery, and you watch these lines back over here, more even out. So these two actions in the simulation resources side are essentially opposites of each other. So they would cancel each other out, as I've just kind of shown you right there. Now remember, those of you who run the software on the fly still have the ability to hover over any of the numbers up in the vital sign area, scroll those numbers up and down and modify them to your specific opinions, needs, and whatever it may be. So again, modifying this is very, very simple to do, given your experience level with the software. So once again, we can just stay within the confines of the event menu, or you can navigate around the screen depending on what your preferences happen to be. So I just wanted to let you know that once we have finished our initial treatment of the patient and intubated the patient, we now move on to disposition options. Remember that once the patient is intubated, we are looking to move and transfer this patient to the ICU. There are some continued care options here as well. So to continue the fluid bolus, post-intubation care, sedate as needed, and finally call the unit where this patient is going to be transferred to. In addition to that, you can still recover the patient, you can still deteriorate the patient, you still have access to the x-rays, the point of care ultrasound, and again, a cough if you so desire, if you need it. Once you've essentially ended the simulation, we move to exposure management, and here are the elements that we want to make sure that we follow through with respect to exposure, again, as laid out by the authors. So identify any possible exposures, liaise with any infection prevention and control officers, policies, procedures, and isolate exposed personnel to that fact, and then finally you're done with the simulation. So again, that is just essentially the way through and how to operate the LEAP scenario, essentially from our software, and then basically stop it for the purpose of debriefing. So I'm going to quickly take you now to a SimPad demonstration, pardon me, and we'll take a look and see what this looks like from the SimPad perspective. So here is a graphic of what your SimPads typically look for. And again, I'm going to take you through the automatic mode perspective because that's exactly what I did with the LEAP interface, but an automatic mode scenario file. Now, quickly to step back before we run this, remember that SimPad was essentially devised for a more mobile type of a resource, and it obviously doesn't have the computing power that that a laptop does, or a laptop that actually has the LEAP software downloaded to it. So there's going to be some limitations to this. So the limitation that's straight across the board is the fact that this device cannot push that x-ray, can't push that point of care ultrasound across, but it can cough and it can deteriorate and it can recover the patient if you so desire. So you're going to notice that this is going to look just a slight bit different as I walk you through it. So I'm going to click on the automatic mode. It's going to give us the folder hierarchy that's here, and we're going to give you some instructions on how to make these on your own SimPads if you so desire. I'm going to access the file through clicking on COVID-19. Here is the actual file itself, and once I activate it here, you're going to be able to see that this one is going to give you some scenario outline. Here's all the information that's available to your learners as you go through this, a learner brief. This is the same thing that you read on the patient monitor, but it's a setup where we're teeing up the patients to know, or pardon me, teeing up your learners and your healthcare providers or anybody that's attending this simulation. We're teeing them up to tell them what they're kind of stepping into. And again, you can decide how much information you give across to them in the pre-brief, whether or based on what they want to do in terms of the gathering of the history and gathering information to make their own decisions as well. So we have placed the learning objectives for you, and we've also provided a checklist as well that's going to get the equipment. So we want to make sure at least that the equipment is equal across the experience. We don't want to remove equipment from one group to the other, as that's going to obviously change or potentially change the outcome of the experience itself. So we just want to make sure that all of that is exactly the same. And again, as you read through this checklist, there's going to be lots of people out there that say, I don't do this. And if that's indeed the case, remove that piece of equipment, remove that objective from the simulation, and again, replace it with something that that's a little bit more germane to your situation. So again, this is what we want to do. We base this on sound science, sound medical procedure, but we also understand that you're going to have your own ways to do this. So we wanted to get something in the public's hands relatively quick. So this is why we're going to provide you with these files. It's going to be a scenario file for LEAP, a scenario file for SimPad. We've also got this drawn up for theme files for LEAP and theme files for your SimPad as well. So just so you know that the information is there, these are all yours. These are all free and modifiable for you to get using straight away in response to this pandemic. So to move on with this in terms of the scenario file from the SimPad perspective, simply push start at the bottom. We have the requisite areas to put in instructor names, participants, and if the team is bigger than 3, we can always add a participant if we so desire, and then whatever element that we have in terms of a debriefing server, if you so desire, to connect into a sim capture circumstance, session viewer, anything along those lines, whatever you have in terms of a debriefing video type of a setup. So this, I'm just going to bypass that for now, click OK, because you want to see how this is going to run from the perspective of the SimPad. So you notice it should look like over here to the left-hand side, we still have the same headings here, assessment and treatment options. And we also do have the simulation resources over here to the right as well. We do have the vital signs up above so that you can see those as well. And again, if you never did anything other than click the buttons from this perspective, once the learners do what they're supposed to do, you don't have to do anything to change the vital signs. They will change themselves. If you want a little bit of deterioration, we're going to click on the deterioration and notice in the upper right-hand corner here, and we now have a trend that's starting to run with the patient. So you can watch the patient get a little bit worse. They're going to, obviously the saturation levels are going to fall. Our respiratory rate's going to increase. Blood pressure is going to remain reasonably stable as defined by the authors as well. And our patient is going to get a little bit more tachycardic as time goes on as well. So again, we can make them a little bit worse. We can make them a little bit better. And same thing applies is if they do get oxygen to the patient, there will be somewhat improvement in the pulse oximetry and to the heart rate itself as well. So there's going to be a little bit of help. But again, all you need to do to operate this is simply stay on this side of the screen. You just click off what the learners do, and then finally intubate the patient, just like we did with the LEAP scenario, with the LEAP version of this. Post-intubation care, typical things that the authors felt we should do, transfer the patient to ICU, and then go to exposure management. Notice that I took the deterioration button, recovery button off on the right-hand side because, again, once the patient is at the ICU, essentially the simulation is over and it's time to debrief. So again, you can click the behaviors as they're performed, move back up into the vital signs. If you don't like any of these things that you're seeing up here, you can always click on the element that takes you to the main screen. And if I want the respiratory rate to change, I can just simply stay here and I can change this to whatever it is that I want. To move back to the screen with the events, we simply move back to here to this area as well. So again, should be fairly simple operations. Hopefully that's what that you perceive as well. I understand that simplicity is always in the eye of the operator. And again, what we're just trying to do is make this so it can be operated quickly. You can get it into the theater as fast as you possibly can in order to apply this to your circumstance as best you possibly can. So what I'm going to do is I'm going to step back and I'm going to end this, and I'm going to show you what the theme file is going to look like from the perspective of the SimPad as well. So remember that we went to the scenario file operating in automatic mode, but we've also provided you with manual mode theme files as well. And I'm going to illustrate that on the SimPad straight away here. So again, Once you step into, these are folders that I've essentially created for my SimPad. And with this one, I just put the COVID-19 underneath the respiration folder. And there it is as far as the suspected COVID-19 SimPad theme. So I click into this. This should be familiar territory for you. Again, we're going to name the session, the instructors, add participants as necessary, and then finally down below, we're just going to click OK. So you can see that once you run a theme, this is just a little bit different than the scenario file itself, and just operates a little bit differently. So in order to start this, the theme file, we just simply want to click Start in the middle, and now our patient has these presenting vital signs. So once we have initially taken care of that travel history, now the patient or the mannequin is going to start out with these respective vital signs. Once we get to the point of initial assessment, I can click and activate, and now you can see that according to the vital signs that are provided in the design, that our patient is going to deteriorate once we initially assess. Now, the question becomes, how do I keep track of those behaviors that the learners are performing like I did in previous versions of this? And down at the lower right-hand corner, there's a gloved hand. You can simply click on the gloved hand, and now you just give credit where credit is due. So the thing I need to tell you about the theme file, however, is that even if I click on the oxygen here, I'm not going to get much of a change to it because themes just don't run that way. These are very simply put together. We get the events or the learner behaviors attached to the theme, but we don't essentially get a chance to control it from here. We have to go back to the main screen, and if we want to change this, we simply just click a new state, and then we get the changes, that the pre-programmed changes according to whatever state that we happen to be in. And if you notice, these are just named after the presentation, the progression of the scenario provided by the authors. And again, these things are highly modifiable. You can create your own, you can change them on this screen, whatever it is that you want to do to modify this patient. We've just provided you with a foundation and some place to go with this as well, so you can get started quickly. Okay, I'm going to go through again the back to the gloved hand. Disposition options, again, you can see the same events, the same expected behaviors from our learners there. And finally, to exposure management, again, everything runs reasonably consistent. And again, if I want to change one of these numbers up here, modify it according to my personal wishes, I simply click on it, and then I just make the changes with the slider bars, activate it, and now the patient has the specific vital sign that I'm looking for here. Okay, so that is a quick demonstration in terms of the SimPad. Very quickly now, we're going to show you how to get a hold of these in 1 minute here from our download demonstration. First things first is that you need to be able to get to the website or the landing page where our files are held. And as Carrie said, she mentioned laerdal.com/coronavirus. This is the home to all of the files that I've demonstrated so far. And I'm just going to show you what this looks like in terms of downloading this information and giving you some resources that you can use in order to get these files onto your own devices as well. So I'm going to move to the page. Here's what the landing page. Oops, pardon me. This is what the landing page looks like as far as the design that our company has provided, and some information on the complementary scenarios to prepare for the circumstance that we're all wishing we were out of at the moment. And then here are the files that are provided. Okay, so again, read these titles closely. You have a pre-programmed case for LEAP scenario. There's the SimPad scenario right beside it, a theme for LEAP and a theme for SimPad. And once you click on the download of the specific file, you'll find this down to the lower right-hand corner. And they're going to be in your downloads file on your computer, and that's where they're always going to reside until you basically tell them to do differently. So in order to get them on your devices, company has provided you with some quick videos down below, again, 2-minute videos on how to download these accordingly from your SimPad and potentially onto your LEAP software as well. So with that, that should just about conclude any of the content that we've had prepared for you. And I think at this time, Carrie, we should probably take some questions.
Yeah, thank you, Kelly. So folks, if you have any questions for Kelly that you'd like him to answer now, real time, while we're together, please go ahead and type them down in that Q&A section on the toolbar. I do see some hands raising. So if you have a question, again, please go to that Q&A icon there and type in your question. While we're giving folks some time to do that, Kelly, I'm noticing some conversation happening over here in the chat. And it was started out with a question in regards to, does the LEAP simulation allow the display of the pre-recorded video of the sneeze on the patient monitor?
It does. And again, the way to do that is to either have the file waiting so that you can actually play it on any kind of a computer, or you can actually embed it into the simulation that I've got here as a media file. So that would take a little bit of instruction on how to program that within Sim Designer. But yes, it is simply it's an MP4 file, if I'm not mistaken, Carrie. And of course, any of those types of files can be assimilated in as a media file on our software. Okay, so yes, the short answer to that is yes.
Great, thank you. Another question just came in. Have you tested this sim in a real sim center with a group of doctors working in ED? If so, what problems did they encounter?
This is not, we have not yet been able to do this. I haven't put this in front of a mannequin, although I'm sitting in a sim lab right now and can test it across, but I don't have access because of the lockdown laws and whatnot. I don't have access to a crew as of yet. The other answer to this is we provided this information to other folks on Wednesday, and we did give the scenario file to other groups previous to this. We developed this, I don't know, probably 2 weeks ago. And I do know that one of our sales individuals has provided the scenario file that was run on a sim pad and a nursing and simulator in front of, I think if I remember his words correctly, hundreds of staff. So we could circle back around with Brent and I think potentially come up with a better answer to that. But I have not done this, but I do know that it has been applied in several clinical environments. What are the outcomes to that, or what are the hurdles that they've experienced? I can't answer that at the moment, but we can certainly find out and broadcast those if need be.
Yes, I did hear of that experience as well, Kelly, and we can continue to update our resource center with that type of information as it's coming in. So please do keep checking back to laerdal.com/coronavirus for additional information on that. Okay, we have some other questions coming in. After downloading the file, are the simulations available to upload into Blackboard?
No, as far as you'd have to tell me what you're looking for in terms of Blackboard. The actual Sim Designer files, I don't know if Blackboard can hold on to those, or if you're just kind of referring to the written scenario itself, is available in both Word and PDF formats. So in that respect, it can be uploaded in predictable file formats. But again, with respect to Blackboard, I don't know if you'd want to pull up the actual Laerdal file, the .scx file that we created for you. I'm not sure that belongs in Blackboard, but of course the other Word documents, the other PDFs where this is the peer-reviewed article itself are highly usable and uploadable.
Very good. Okay, does modifying your simulator for the sneeze function void your warranty?
At this point, when I've read through the props with it, it is simple enough to be applied. There's always a risk of voiding warranty depending on what you do with your mannequin, but in this case, it is such a simple thing. It's just an air tube that actually pushes, a substance that looks like mucus. So, whereas there's always a risk, I don't think so with this one. I think it's just a simple addition of an aerosolized kind of a deal. So going back to the question that was asked a little bit earlier, as far as can we show the sneeze on the software, that might be the safer answer for you. So I don't ever want you to modify a mannequin to the point where it could become non-warranted. That's just not our function with this. So if that's indeed something that you're a little bit afraid of or concerned about, I would go the video way. I would actually put this up on the patient monitor and just show them the video. Remember that you can always mock up your mannequin as well. And even though it doesn't show you the sneeze, you can see that in several different ways on a video. You can show them the aftermath. So you can put your mucus recipes to good use. So put that on the mannequin to make it look like its nose is run. or something along those lines. Remember that your 3G can actually have a runny nose as it is, and you just kind of color that stuff up as needed. So make it look like the part, but again, modifying a mannequin, that's entirely up to you. But if I were worried about it, I definitely wouldn't do it. There's other ways to show this symptom or this sign, pardon me, where the mannequin is sneezing and give you the idea that there's a possible exposure here. So lots of ways to figure that out.
Good suggestions, Kelly. Thank you. What version of LEAP were these programmed in, and can they work in earlier versions if we haven't upgraded yet?
It just depends on how far you go back. This one has features that were programmed on 6.8, but as far as when I've run these before, the first thing you just have to do is experiment. Remember to get it downloaded onto your LEAP computer. And the files are relatively innocuous. They'll go back quite a ways, because again, it's really just the mannequin features that are a little bit, kind of up for grabs. This file was created for a SimMan 3G platform, but it can be run on SimMan ALS. It can be run on Nursing Ann. It can be run pretty much anywhere. But now think about the differences between those mannequins. Now, SimMan ALS doesn't have blinkable eyes, so you might get a message that if the mannequin was told to close its eyes, due to like the appearance of well, really just non-perfusion. If it's the mannequin is actually going to expire, our mannequins are told straight across in the software design to close their eyes. So what do you do with a mannequin that can't close their eyes? Well, you basically ignore that and move on with the simulation. So it's really not a problem of versioning, moreover, than it is what are the differences between the mannequins where you may run this. So what I would tell you, just to be on the safe side, is experiment, download it onto your previous version, give it a chance, try to run it, and see if there's any problems with that. But I have never seen in my career with this, since LEAP has been designed, where we couldn't retroactively run these simulations. Now, I can tell you that you're not going to be able to take this file and run it on legacy software. That's just not going to happen. But by and large, as far as I know at this point in time, it should run on pretty much any version of LEAP. If you do run into problems, again, get a hold of tech support. They're going to walk you through. If you do need to do some updating and upgrading, they're going to walk you through that process.
Great. Thank you, Kelly. Another question's come in. Can you connect to a virtual simulator and run the pre-programmed scenario with a lower tech simulator, like an airway torso, for example?
Yeah, that's precisely how you'd run it with a standardized patient. So precisely, if you see what I did with this demonstration here, this was obviously on the virtual mannequin itself. So you do the same thing and just put the torso to the side of or wherever you're going to simulate. So I think that's an awesomely good idea. It's a great way to use the software, great way to use a task trainer. And again, just as your resources are there, modify this as needed. This is a great example of it.
Great. We've had a few people ask if we can repeat again showing how to download the scenario. Are you able, Kelly, to go back to our website and just show that process again?
You bet. Okay, so first and foremost, I'm back on the website, or at least I'm intending. Carrie, do you have confirmed that I'm good to go here?
Yes.
All right.
See it.
So first things first is that, and I've already kind of gone into this, but the landing page, just as you read through it, Carrie and her crew have put pretty good instructions on how to do this. So find your scenario. And again, it's just the first bullet statement that's right here. Click the plus sign, and that exposes the files themselves. So go ahead and click on download the scenario here, and then that's going to pop it. Now just follow my cursor down to the left-hand side. Now I've got two versions of this sitting right there. So if I click on these, if I right-click, pardon me, it's going to give me show in folder. And this is where the folder is, that it's actually downloaded your scenarios onto this computer here. Okay, so that being the case, I would just take this file and again copy it. It just depends on the computer. I got to get this on my LEAP computer, so I can right click, I can copy onto that file. Pardon me, one more time here. Copy it, and then I just paste it onto my desktop of my LEAP computer. And however you choose to move that file over, it can be like with a flash drive. It's just got to get on your LEAP computer somehow, some way. Once it's on there, this is what I'm going to show you here if I possibly can. Okay, so we're given this run a session. Because this was the automatic mode scenario file, I'm going to click here, and it brings up this dialog. Okay, so the first thing that you notice that since I ran this scenario previously in the demonstration, it just tells you the most recently used and the recent version or the recent scenario that was run. So that's one way that you can kind of see that it's already locked in here. But if I had to go find the file, the secret to it is up here in the browse. So if you just simply click browse, well, where did you put it? Now I just put this out on the desktop. So I'm just going to go through, make sure that I've selected my desktop here. Now, if you just kind of move through with me, you're going to find this. And there it is. So once I've downloaded it and got it to my computer, I just simply find it. And again, you can put it in any place you want. But simply, I just put it on my desktop to illustrate this. So I can double click that, and now I'm going to run that simulation. So that's how to download it, get it onto your computer, and then access it via your LEAP application. And once you click OK, then this should take you back to predictable areas. Okay. There she is on the patient monitor. And there we are. Now we're back to the actual running. So that's about, and again, I think the video is going to do this better to whomever has asked this question. It's obviously going to show you some fairly recipeed ways on how to do this. But, you know, we all kind of have our opinions on how to get this stuff onto computers. And again, if you're sitting in a military base that doesn't allow flash drives, you're going to have to get this computer, at least your LEAP computer, to work and access the World Wide Web. Once you access that, obviously Carrie's got the URL for you, and you can just download straight onto your LEAP laptop. But it really just depends on your circumstance, your security, so on and so forth. Okay, so, but that's how I would do it, sitting in my own lab at the moment right now. Just get it off the internet, put it onto my LEAP laptop, open up a automatic mode scenario, and then search for browse. Then I can find the file I'm looking for.
Great, thank you, Kelly. And are you able to go back to that landing page view once more? There you go. Some people are asking about downloading the actual article. So if you see there the blue EM SIM cases link. No,
oh, there
sorry.
they are.
Yeah, and just click that, and that brings you directly out to the actual article that was written from the peer-reviewed group and all of the other resources that Kelly had mentioned earlier on. So this is also where you would download some of those props, the instructions for the props, and some of the other materials.
Yeah, and here's just a good demonstration of that sneeze, and they've run this with an older mannequin, but you can kind of see what this looks like. So, and again, you know, showing that video to somebody on the patient monitor should be able to do it, but again, you can moulage up your mannequin. This was an older, like a Sinman classic that is just no longer, you just don't see them much anymore, but this is what they did for that process to get that across to their learners. So there's a lot of different ways to do that, but I thought this was pretty easy to kind of get the idea. So, okay.
Okay, great. So the majority of the other questions are in terms of, will this file be, you know, this webinar be available for download later for those folks who weren't able to join us? The answer is yes. That will also be added to laerdal.com/coronavirus once we're able to get this file prepared for that. And I think that would conclude, for the most part, our Q&A as I'm looking through. I do want to mention, we do have a user on here in the chat who's mentioned that they are currently running this scenario now at their facility. They're not aware of any obstacles that the teams run into, but I do appreciate, Kevin, you bringing that up. And we look forward to hearing on how that goes for your team. Thank you, everybody, for joining us. If there's any questions that did not get answered, we will be going through them and answering those directly through email in the next coming days. Just watching to see if anything else pops in here before we say our goodbyes. But I think we look good. Kelly, do you have anything to add in conclusion?
Nothing more than good luck out there. I know we're all in this together with this, but this is unprecedented times. We're doing our best. Yeah, stand by. We've got more information. We are efforting to build pediatric cases for you as we speak, and those will be available as soon as I can get them programmed, but it'll be the same thing. We'll make sure that they are on this landing page where you can get a hold of this information as soon as you need it. So stand by. We're doing the best we possibly can to keep up with what the need happens to be. So Carrie, thank you as always for leading the show here. I just wish everybody the best.
Thanks, Kelly. We appreciate everyone, and we will, as I said, answer any questions that were not answered via email. Take care, everyone. Be safe.